Okay, so we are looking at leukemia under medicine, and we'll go straight to look at the question for leukemia that we are looking at today. So the question reads, Anita Shula, aged 24 years old, is brought to your ward with complaints of anemia and recurrent infections. A provisional diagnosis of leukemia has been made. Question A says, discuss any 3 types of leukemia. Question B, list 5 clinical features of leukemia. Question C, discuss the management of Anita during hospitalization under the following headings: medical management, and C2, nursing management. And question D, state 5 points you would include in your information, education, and communication to Anita's mother on discharge. So that's the question for medicine that we are looking at. So we'll start with defining leukemia in case you are asked to define leukemia. We can define leukemia as this is a malignant blood disorder in which there is hyperplasia of white blood cells and their precursors, characterized by fatigue, bleeding, and recurrent infections. When we talk of leukemia, we are referring to cancer of the white blood cells. But when we talk of sickle cell, we are talking of a genetic disorder where the red blood cells are sickle shaped. So that is the difference. Leukemia, it is cancer that affects the white blood cells. And because there is overproduction of immature white blood cells that cannot differentiate and grow into adult cells that can perform a function, hence that is where cancer comes from. Now, one of the characteristics we'll see is fatigue. We see fatigue because in leukemia, the body from the stem cells focuses on reproducing immature white blood cells and forgets about production of other type of blood cells like plasma and the red blood cells. So because in leukemia the RBCs are not being produced in high amount, hence the child ends up going into anemic state and they experience this chronic fatigue. Of course, also bleeding tendencies because plasma proteins are not being produced from the stem cells because of infections affecting the white blood cells, and this in turn causes the patient to have bleeding tendencies because they lack plasma. And of course, recurrent infections because the patient has immature white blood cells that cannot perform a function. It is like you have 100 babies and you give them a small portion to farm. They won't do anything, they'll just be playing there. That is how leukemia is. This patient has a lot of white blood cells, but because they are immature, they can't do anything. Hence, instead of having a stronger immunity, it is actually the opposite. This person has a very weaker immunity because the cells they have are not performing any function whatsoever. So in terms of defining leukemia, that is how it can be defined. Now, before we go to the first question from our scenario, when we talk of leukemia, we are talking of how cells develop from the stem cell. Remember, from the bone marrow, we have the parent cell or a great grandparent cell known as a stem cell, because this is where all the type of cell originates from. So from a stem cell, now you have 2 parent cells, which are either lymphoid cells or myeloid cells. And when we talk of the myeloid cells will end up producing a myeloblast. And the myeloblast can now either produce red blood cells, platelets, and also can reproduce white blood cells. But again, from the same stem cell, we can end up having a lymphoid cell. And when we talk of a lymphoid cell, it only produces white blood cells. So this is why we are going to end up having the T lymphocytes and the B lymphocytes coming from or originating from. And when you look at our immune system, remember it is the T lymphocyte or the B lymphocyte that will strengthen our immune system with strong white blood cells. So when you talk of leukemia, the type of cells that are affected, it is either the myeloid stem cells or the lymphoid stem cells. They are the ones that are affected, not necessarily the end product, which is the white blood cell. No, we have different forms of white blood cell, but the problem is coming from the myeloid stem cell or the lymphoid stem cell. And this is why leukemia is difficult to treat, because the end products as they come cannot differentiate into basophils, neutrophil, eosinophil. They can't differentiate into that because the parent cells are damaged from the cancerous cells. So when we talk of leukemia, the problem is from here, and hence even this side the platelets can't be produced, RBCs can't be produced, same as the white blood cells can't be reproduced. So when you talk of the cancer of the white blood cells, that is where the problem come from, and that is why you see people going for stem cell surgery or procedures is to help with that process. Now, going back to our question A, which said, discuss any 3 types of leukemia. The first type of leukemia that we can talk of is acute lymphoblastic leukemia. When we talk of acute lymphoblastic leukemia, in this type there is the rapid replication of lymphoid progenitor cells, which affects the white blood cell count. And this type of leukemia is common in children. It has a rapid onset with symptoms like fatigue, bleeding, and fever, and it is mostly treated best with chemotherapy and also with stem cell transplant. So that is about the first type of leukemia, which is acute lymphoblastic. Some other books, they will be written lymphocytic. It is one and the same. The other type is acute myeloid leukemia, and in acute myeloid leukemia there is rapid reproduction of the myeloid cells, and the myeloid cells now they will affect the red blood cells, the platelets, and the white blood cells themselves. And this type of leukemia is commonly seen in adults and the elderly, and it is characterized by mostly rapid progression, anemia, fatigue, infections, and bleeding itself. And this one is commonly treated with chemotherapy itself and also bone marrow transplant. So those are the 2 forms. And the other forms of leukemia are the chronic ones. So we have chronic myeloid leukemia. We also have chronic lymphocytic leukemia. So when you talk of the 4 types, it is the acute form and the chronic form. Now, when you talk of chronic myeloid leukemia, this one has a slow progression and it affects the myeloid cells and their precursors. This one is common in the middle-aged adults, and it is often associated with a Philadelphia chromosome defect, and the cells generally mature abnormally and often accumulate in various organs over a long period of time. And apart from that, because of their abnormal structure, their ability to fight infections and assist in repairing injured tissue becomes affected. So when we talk of chronic myeloid leukemia, the type of cells still being affected are the myeloid cells. But we see that in individuals who have the Philadelphia chromosome defect, these people will have defect with the progenitor cells or the T lymphocytes or the B lymphocytes in the way they are supposed to differentiate. and as a result these cells will be circulated in the body, but wherever they go they fail to mature into normal adult white blood cells, but they mature abnormally, even bigger than the normal size. And this is what makes them accumulate in various organs, causing swelling of those organs where they are accumulating from. Hence, in such a patient with such a presentation, they'll be termed as having chronic myeloid leukemia. So for question 1, which said types of leukemia, those are the types. And when leukemia comes, the types don't miss. Sometimes they'll ask you to explain 2 types. Sometimes they'll ask you to explain 3 types. It is because it is in rare cases that you'll be told to explain 4, because the chronic forms are just the opposite of the acute forms of leukemia. So in terms of the types of leukemia, that is about it. Question B is saying list 5 clinical features of leukemia. Of course, the question just said list, so the patient may have bone pain, and bone pain, this is due to ischemia. Remember the bone marrow, that is where the stem cells are coming from. And the bone marrow is the one of the organ in the body that is highly supplied with red blood cells. That is why the bone has good healing amongst all organs in our body, because of high blood supply. But in this case, in leukemia, the red blood cells, the platelets, are not being produced in normal amounts, because the body has concentrated on producing mature white blood cells. And because there is less red RBCs, this results in tissue ischemia. As a result, the patient ends up having bone pain and not joint pain. Easy bruising due to low platelet levels, especially as a patient who's having myeloid leukemia, because there will be no plasma protein or platelets being reproduced by the body. Hence, the patient will have easy bruising. It will look like they are having blood settling under the skin, like someone had beaten them, but those marks, when actually no one slapped them or had beaten them on that body area, because of settling of blood just under the skin. Also, bleeding from the gums and nose due to low platelet levels. Blood in urine or stool due to renal involvement. And of course, when we talk of renal involvement, you find that because of renal ischemia, the renal glomerular basement membrane becomes bigger, the pores becomes bigger, and they end up allowing bigger molecules like the blood to be lost in urine. Hence, we see it in urine. Then the GIT, of course, because of easy bruising, we may end up seeing blood in stool, mostly dark blood, like clots of blood, because of that. Then, of course, enlarged lymph nodes or spleen. This is due to accumulation of white blood cells in the lymph node or in the spleen itself. Generalized body weakness is another symptom that we see because of tissue hypoxia. Headache, these are other symptoms that we see because of cerebral hypoxia. So the question just requested to list, but in case you are told to state, it means that you explain how its symptom is coming about. So there are many symptoms, of course. Fever is also seen because of increased metabolic weight, unexplained weight loss, because of increased metabolic rate with inadequate intake, increased infection because of lowered immune system, night sweats because of fever, and of course headaches because of cerebral hypoxia. So you can choose any 5 amongst all these symptoms that have been mentioned. So apart from signs and symptoms, the question also said discuss or describe the management under the following heading. And of course, C1 said medical management, meaning medical management, you always talk about investigations and the possible treatment being given. And of course, in terms of aims, you can say to promote a quick recovery, to relieve symptoms of leukemia, to relieve pain, to prevent complications such as anemia. From there, in terms of possible investigations that can be done, for history taking, you say the patient will present with history of cancer in the family. And of course, the history taking, there are a lot. Sometimes the patient may just present with history of environmental exposure to cancer. Like right now, we have higher cases of cancers in Zambia, such that even our cancer disease hospital is full, like it's a general medical ward. And most of these cases are coming either from copper belt or which one, Kabwe, because of mining activities. And these are exposures that are not happening right now. These are people who were exposed probably even 10-15 years ago. And these are the same cases we are going to end up having 10 years from now, coming from Solwezi. Because our politicians, sometimes they do not have the interest of the people. You find that there will be pollution for cancers. Sometimes it may just be environmental exposure, because you may be exposed as a parent, but then the effects are seen in a child later on. Physical examination. During physical examination, the patient will present with headache, bleeding, and enlarged lymph nodes. Laboratory investigations, we can do full blood count, which will show raised white blood cells and low hemoglobin. We can do lymph biopsy, which will show accumulation of white blood cells. We can do bone marrow biopsy, which will review overproduction of white blood cells. Once you have 5 investigations, then you can talk about treatment. And these drugs we are talking about here, you can still use them in other cancer conditions. It can be maybe you are given stomach cancer, or you are given colorectal cancer, or benign prostatic hypertrophy, or it could be breast cancer. If they ask for medical management, these 3 drugs can still be used in all other types of cancers. So we can give vincristine, and remember these are what? These are chemo drugs. So when we talk of vincristine, it is 2 milligrams. Actually, this is supposed to be per meter squared. IV once daily for 3 weeks, or once per week in a period of 6 months. So most of the cases, because in Zambia we don't even have enough of these cytotoxic drugs, patients may be put on maybe treatment just continuously for 7 days, depending on the extent of the staging of the cancer, or maybe once in a week for a period of 3 months or so. Then of course, vincristine has side effects such as alopecia, diarrhea, and cellulitis. And the nursing implication, of course, you monitor the side effects. If severe, you can discontinue and report to the physician. And of course, the other drug that can be given, which is a cytotoxic drug, it is cyclophosphamide. So cyclophosphamide, you give 800 milligrams per kg body weight IV once daily for 3 doses in 3 weeks. And of course, the mode of action I've already mentioned, it's cytotoxic drug. Side effects: anorexia, pancreatitis, nausea, and vomiting. The third drug that we always give together with anti-cancer drugs is always an anti-inflammatory drug, and mostly would give prednisolone, but of course even hydrocortisone, dexamethasone can still be given, but preferably most of the cases will give prednisolone as together with cytotoxic drugs. And the dosage is 25 to 30 milligrams once daily orally for 14 days, or you give 25 milligrams every time the patient is on cytotoxic drugs. So in terms of the administration, that is how it is given, because anti-inflammatory drugs reduces the effects of cytotoxic drugs. Cytotoxic drugs may easily end up damaging also the normal tissue and normal cells. Hence, we'll give anti-inflammatory to reduce that effect on normal cells and normal tissues, so that the patient should not have problems from body tissues and organs which never had a problem. So prednisolone, of course, it has side effects like reduced immunity and dry skin as well. And of course, nursing implication, you discourage the patient from taking the drug for a long period of time because it reduces immunity. And this patient with the cancer, they already have a lower immune system, meaning that this drug will severely reduce their immune system. So in terms of at least the 3 drugs that you can talk of, these are the 3 drugs. But there are many others. If you forget this, you can still give doxorubicin. So doxorubicin can still be given in this type of cancers and other stomach cancers. So once you talk about the medical management, the question C2 said nursing care or nursing management. And in this particular case, you are just talking of the general nursing management, which is a prophenema, because cancers are neither infectious conditions or emergency conditions. For general nursing care, we talk of environment. Of course, you talk about all these points on environment. From there, you talk of position, and then you talk of rest, of course. You talk of observations, and these are details that we have talked about several times. You discuss psychological care. From there, talk about hygiene. From hygiene, you talk about exercise, talk about nutrition, you talk about medication. From there, you talk about elimination, of course. So when you talk about a prophenema, those are the points that you can talk about. And at least by now, we should be able to memorize the details of a prophenema. The last question talked of 5 points that you can give as IEC to Anita's mother on discharge. In terms of IEC, you can talk of medication adherence. In terms of medication, you advise the importance of taking the drugs as prescribed and completing the chemotherapy cycles, because chemotherapy gives a lot of severe side effects. Mostly patients tend to stop chemo treatment. Of course, we have seen that in of chemotherapy. Infection prevention at home, of course, this IEC, you advise them on proper hygiene, avoiding overcrowded places, and early reporting of fever or infection signs. Nutrition, the importance of nutritious meals, because you want the patient's immunity to be strong, and this will promote recovery. Regular follow-ups with cancer patients. Regular follow-ups are important because you also want to monitor the staging of cancer, because at a point when the patient reaches stage 4 cancer, at stage 4 there's nothing you can do, because the cancers have spread to even other distant organs, meaning that even if you did a surgical procedure where someone has developed cancer, maybe in the liver, and you want to do a surgical procedure, you're not sorting out anything, because it has spread to other organs. And at that moment, the only solution is just palliative care and prepare the patient for their time of death. So most patients complain. Those who had cancer is, of course, psychological care. Encourage support groups, counseling services for both Anita and the mother, because they'll need it. And of course, that is about the IEC that you can give. In terms of complications, certain complications that may arise in leukemia includes anemia and also infections because of reduced immune system. So the patient may have recurrent infections, bleeding or bruising tendencies because of lack of clotting factors. Renal failure may also be seen because of reduced HB, which reduces oxygen carrying capacity, and this results in damage of the renal glomeruli. Metastasis as well, leukemia can spread to the brain and also the spinal cord, causing complications of the central nervous systems. So in terms of certain complications that can be seen, these are some of the complications. So if you are asked to about how to manage